Hello, everyone. Thank you for joining us in our education session today. It's going to focus on simulation exercises. I am Dana Finnegan-Yee with the IPAC Hub and Spoke team, and our entire team is here today to assist with presenting different aspects of our session. We have Lana King, Sarah Lee, Caitlin Prentice, Eric Hofstay, and Kim Craig. Just some reminders to please keep yourself on mute. If you have any questions, we can discuss those at the end of the presentation. And if there's any issues, please type them into the chat. If you would like to have a pen and paper ready for note taking, that would be great. But if not, don't worry, because we are going to record this presentation and post it to our website for later viewing. Our team has been reviewing resources to be able to support facilities that are looking to complete this aspect of preparedness planning that was outlined in the PHO Fall Preparedness Checklist. Perhaps when you saw a tabletop exercise in the Fall Preparedness Checklist, it might have generated some questions for you, such as what are these? Where do we start? Who needs to be involved? Or how am I going to do this with everything else that's going on? These are all understandably fair questions. So whether you're new to IPAC or if you're in a lead role that has involvement in potentially facilitating an exercise such as this, we hope that we will be able to provide you today with some information to help support you in initiating this type of activity in your facility. We have worked towards simplifying this process that is involved in the planning, the delivery, and in the follow-up or review.
So for today, this will be a train the trainer exercise to enable a successful functional exercise to use in your facilities. This should really be considered an opportunity to review, strengthen processes, and bring forward new ideas during the collaboration aspect. This can be delivered in a very simplistic manner, or if you choose, it can have added layers and complexities. So what we'll be talking about today is an exercise that really offers flexibility to make it your own so that it fits your organization. Before we move into the main presentation, I'm going to briefly hand it over to Caitlin to review some IPAC Hub resources that were previously offered.
So one of the first education sessions that was offered by our team was related to outbreak management back in May. In this session, we went over outbreak preparedness and outbreak management, and this also included an outbreak case scenario review that was discussed and worked through to familiarize everyone with outbreak response, line lists, and more. If you were not able to attend that session, the link to the presentation is available on our website. The second education session performed was related to surveillance and details of what should be included in a surveillance program. This session was presented in September and it was recorded. The link to view it is available on our website. Now I will hand it over to Sarah for an introduction to Slido.
Thank you. So we will be using Slido during this presentation. So first you want to go to slido.com. As seen on the screen, you can go on your phone or on your computer. Under joining as a participant, you just want to put our code in. So that's IPAC Hub, IPAC, HUB. And once you put the code in, it should take you into our event, which will look like this. So we'll first have a test question to see how many participants we have, but also for those who aren't familiar with Slido. So our test question is, what is your favorite Canadian winter activity? Okay, looks like we have everyone's answers, and so I hope you understand how to use Slido, and if you have any questions, just put it in the chat. So I'm going to turn it over to Lana now for reviewing the objectives for today.
Thanks, Sarah. So the learning objectives outlined for today are to explain what simulation exercises are, to clarify the difference between a tabletop exercise and a drill, and provide you with information about why these exercises are important. We will outline what the process could look like for conducting a tabletop exercise and then provide you with a staged scenario and work through points of discussion to be able to facilitate within your facility. Finally, we'll discuss outcomes you would like to see from your exercise and important follow-up to perform after conducting this type of exercise. On the next slide for today's agenda, we want to provide you with a train the trainer format and an outline of how to successfully conduct this type of exercise in your facility. We'll walk through key processes that are generally involved when conducting a tabletop exercise, and then outline how the roles and responsibilities for participants within your group can be structured. For the scenario portion, we'll outline a staged scenario and provide suggested updates that can prompt more discussion, decision-making, review processes, and promote internal and external collaborations. Throughout the scenario, we'll provide you with what you'll become more familiar with as injects, and these are the new aspects shared in relation to an evolving situation. There will be additional case scenarios we'll share with you at the end of the presentation for your information and use if needed to provide some variety for scenario selection when planning your facility's exercise. I'll turn it over to Dana for more detail on what simulation exercises are.
Thanks, Lana. So what is it that we're talking about? What are simulation exercises? Simulation exercises are controlled activities that involve a simulated emergent situation that could occur in reality, and it is imitated for training purposes or for testing a facility's response and preparedness for an emergency situation. What does this all mean? And how can we simplify this information so it's realistic to work through within your facilities? There are different types of simulation exercises. There are tabletop exercises, mock drills, and case scenarios. Some simulation exercises involve discussion-based exercises like the tabletop, where stakeholders actually talk through and discuss a scenario. And the atmosphere in those is calm and the format is to be low stress. Other exercises like drills, they are operation-based, where the facility will walk through or actually perform the steps of the emergency action plan. And these are more formal, they're in-depth and extensive. These are commonly used in hospitals or at county level emergency management annual review meetings or planning as part of their preparedness mandates. So on the next slide, you can see that we've created a video. The IPAC Hub has developed a video to further clarify what it is we're talking about. Let's watch.
The IPAC Hub presents information on simulation exercises. What are simulation exercises? Simulation exercises are controlled activities where a situation, which could exist in reality, is imitated for training purposes and for testing a facility's response preparedness for an emergency situation. There are different types of simulation exercises. There are tabletop exercises and case scenarios, and there are also mock drills. Some simulation exercises involve discussion-based exercises where stakeholders talk through an emergency scenario, where others are operation-based exercises where the facility walks through the steps of an emergency action plan. Let's discuss each in a bit more detail. First, what is a tabletop exercise? A tabletop exercise is an informal discussion-based activity that can be presented by a facilitator. A team discusses their roles and responses during a simulated emergency situation. Tabletop exercises use simulated scenario that is progressive, which allows participants to consider the impact of a potential health emergency on existing procedures. The atmosphere is meant to be informal, cordial, and calm to ensure the exercise generates discussion of various issues that could arise during an emergency. A tabletop exercise not only helps participants become familiar with the response process, but enables administrators to gauge the effectiveness of the facility's emergency response preparedness. Let's now review what is a drill. A drill is a functional exercise, and they are primarily designed to help employees practice specific tasks or routines related to their role. Drills are operation-based exercises in which a facility actively walks through the steps of an emergency action plan. These involve more personnel and are typically more expensive to facilitate than a tabletop exercise or case scenario. Drills can disrupt the facility's daily functions when they are taking place. Simulation exercises can be low-cost, yet highly effective methods of evaluating emergency response plans. IPAC is about prevention, and it's important to plan ahead and be prepared.
So we hope that video was helpful and informative to you and gave a good explanation and description of the different types of exercises that can be used. Let's review and test your knowledge using a couple of Slido questions. Lana will run the first one.
So for the first Slido question, how would you describe the atmosphere of a simulation exercise? We'll just give you a couple seconds to put in your answers. That's great. So those answers accurately reflect and provide a comprehensive list of how to describe what the atmosphere should be like for simulation exercises. So we would want them to be relaxed, discussion-based, informal, flexible, engaging, friendly, and calm. Thank you. And Dana will facilitate our next one.
Okay, so let's answer this question. It's multiple choice style. What is the difference between a tabletop exercise and a drill? There's 4 choices there. A, tabletop exercises are flexible, informal team discussions about rules in an emergency. Drills involve more participants who walk through an emergency action plan. B, tabletop exercises are complex, formal, stressful activities, and drills are quick, easy exercises involving minimal resources. C, tabletop exercises are discussion-based, and drills are operation-based. And last choice, D, A and C, both. Let's give you a minute to put in your answer. Okay, so we can see the answers have been entered and everyone got that right, with both A and C being the correct choice. Thank you for your answers. Moving on to the next slide, Lana.
Performing simulation exercises is an opportunity to review processes, strengthen a practice or procedure, and it can also just be simply used to review or confirm processes that are already in place and confirm that they're working well or that they're expected to work well. So they can be useful in determining that participants can realistically talk through their critical roles and functions to ensure a solid understanding before experiencing a real situation. We'll continue on the next slide in more detail. Because we're always learning and we've learned a great deal over the course of this pandemic, a lot has happened and there's been a lot of information. It's very important for staff to be prepared. So people will respond to a high pressure situation in a way that they have been trained. So talking through a simulated exercise enables the reinforcement of the proper steps, of approved protocols and processes. And as for how these can help, because simulation exercises are discussion-based and allow participants an opportunity to review plans or policies, this allows them to become more comfortable and respond to a high-pressure situation because of the experience or that the exercise has provided. Staff can also learn from mistakes in a safe and supportive environment and gain experience with a situation that they may not encounter routinely. These exercises also offer a unique learning opportunity and enable the sharing of perspectives or best practice resources that others in the exercise might not be familiar with. And they're also an opportunity to bring together your experienced colleagues and those that are that have new ideas. So perhaps those that are new to the facility, if there are new program leads or those new in a role, they bring their past work experience for contribution, and also gives them an opportunity to become more acquainted with processes and plans in their new setting. So it's important to recognize that the purpose is to allow for identifying gaps, improving processes in a non-threatening exercise. And it's also important to mention that these exercises might not identify gaps, but just rather confirm and solidify that comprehensive response plans are established. So now that we understand why these exercises are good to perform, I'll hand it over to Dana to review the preparation steps for conducting a tabletop exercise.
Thanks, Lana. Now that we've talked about what a tabletop exercise is and why it's important, let's review in a bit more detail the actual process and how to plan and deliver these exercises. So on the next slide, we're going to go through how to prepare for a tabletop exercise. There's suggested steps that you can use. So first of all, setting your objectives. It's important, or defining your scope. It's important. This means you need to outline what it is you hope to cover and what you hope to achieve from the exercise. So in other words, what is it that you want to test? Your objectives need to be manageable. They should not be too broad or complex so that you can work through the exercise without difficulty. Secondly, you want to select people, your stakeholders. There's generally three key categories related to your exercise participants. So you need people to facilitate, participate, and observe. A facilitator is someone that needs to actually run the tabletop exercise. An evaluator is someone who notes the details and the actions throughout the exercise. And then, of course, you need some participants. So these are the people that are going to play and observe. We are going to discuss these roles in more depth in the upcoming slides. But thirdly, you also need to create an environment that is conducive to learning. So in order to do that, you want to be organized, you want to be prepared, and you want to consider your format. Nowadays, people are doing things virtually. So is your exercise going to be virtual? Is it going to be in person? Where is the best location for a good discussion to take place? You might want to include some key documents that are relevant to the exercise. Is there a policy or a directive that's relevant to your outlined exercise? You don't have to have participant handouts, but they could be very helpful. If they're offered, if you do have them, you may want to include what to expect, a summary of the exercise, the purpose, and the expectations. And fourth, you want to actually select your exercise scenario. So this is very important because it's the storyline. It is what your exercise is going to be based on, and it needs to be realistic and believable, something that could actually happen with a threat-based component. It should be demanding but not overwhelming, and it needs to be directly related to the exercise purpose and objectives. The scenario should engage and include all of the participants. And as noted in our objectives today, we are going to provide you with some scenarios to use, and these scenarios can be modified so it relates to your organization and your participants. Lana's now going to review in some detail the different roles and responsibilities involved in a tabletop.
So one of the main required participants is the exercise facilitator. So the facilitator will introduce and present the scenario. They facilitate group problem solving, control the pace and flow of the exercise, and stimulate discussion. The facilitator will enhance discussion by using injects or updates and provide the problem statements that occur on a timeline related to the exercise scenario. As a facilitator, you don't need to solve the problems or jump in with what you feel the right solution might be. Allow the participants to bring this out given their knowledge within their area of expertise and of policies or resources that they may have access to. If a facilitator notices that someone is struggling, they can pull out responses with probing questions. During the exercise, if gaps are identified, the facilitator does not need to resolve these during the tabletop exercise. These discussions can occur later with the appropriate stakeholders. And that's an important point so that you're staying on track and not getting stuck on areas that are not resolving, preventing the exercise from moving forward. To move forward during the exercise, facilitators will need to ensure that they're moving along at an adequate pace and not moving through it too quickly. If moving too fast, it creates the risk that aspects are not being thoroughly reviewed. And it's important to meet the objectives and deliver all of the injects or updates. As well with any adult learning, just modeling the behaviors that you want the participants to demonstrate, and participating can be facilitated by acknowledging comments in a positive manner so participants feel that they're being listened to and supported. If an evaluator is present, they do not need to participate in the exercise, but can be in the role of taking notes of their observations about what happened during the exercise. And the evaluator can specifically reflect on the group's ability to achieve the outlined objectives. So they may be taking notes on action items that should be considered to address gaps identified during the exercise. And this information would also be used in the follow-up report and discussions. And we'll talk about how these two roles come together to collaborate during the end stages of the process of the exercise in a couple upcoming slides. So the participants are the exercise players, who are facility staff and those invited to address the goals and objectives of the exercise and participate in the facilitated discussion. In consideration of your goals and objectives, these will help to identify who should be included as a participant. But don't worry if the first time you realize that someone was left out or there is a gap in who it would have been beneficial to include. This is a learning opportunity to be built upon so the next exercise becomes more comprehensive. An optional role is the exercise observer. So some exercise planners may appoint observers. Perhaps these are from other disciplines or external partners to observe the exercise and provide feedback. So this is a role that our IPAC Hub team could potentially assist with to support if capacity allows to fill this role as an exercise observer. On the next slide, the process for conducting a tabletop exercise is outlined as follows. And the first step being the facilitator will want to set the stage and explain to participants what will happen by providing an overview of the exercise so everyone's feeling comfortable with what to expect. Providing a clear explanation of the purpose and objectives of the exercise, any ground rules for the players, and procedures to be used in conducting the exercise. So this could involve communication to staff in the facility that an exercise will be in progress. Next, the exercise is conducted. So start the exercise by presenting the opening scenario and introducing the first situation. It's important during the exercise that everyone's participating and that not one person is dominating the exercise. So organizing the inject so that all participants must deal with a question or a problem is helpful to achieve full participation. Following the exercise, it's very important to have a debriefing. You might also hear this referred to as a hot wash. So this involves all the participants, and this will identify the strengths, the gaps, and if the response was effective. And this can be done simply just by breaking down and identifying 1 to 3 of the most important accomplishments achieved during the exercise, and then discussing 1 to 3 important gaps identified for further action. And that's if there are gaps identified that require further action. To ensure the exercise is fully effective, it's very important to create an evaluation report. And earlier I mentioned the facilitator and evaluator come together later in the process. So it's at this point that they collaborate regarding the experience of the exercise, any highlights, strengths, or areas for improvement to include in the report. And this doesn't need to be formal. It's just highlighting broad categories, outlining the key areas to summarize. Finally, in the last step, reviewing the action plan. So this occurs after the exercise and is related to if there are established priorities and timelines to review a gap or an issue. So this doesn't involve all of the exercise participants. It involves a select group that are key to resolving or closing this gap. I'm going to hand it over to Kim and Eric to share with you some resource templates that can help to organize the information from the different roles during the process of the exercise.
Thank you. So this is a sample tabletop exercise planning worksheet. We'll provide you with a copy of this template as a Word document, which you can use or adapt for your purposes. This worksheet can be used by participants to organize goals and objectives, record discussion points to contribute during the exercise, or action items for debriefing later, which may further contribute to the report or summary of the exercise. These are easy to create and they do not have to be exactly in this format. You can tailor one to suit the needs of your exercise and your facility. To break this down further, we'll go to the next slide. So these are the worksheet instructions. Participants use this worksheet. They write a concise goal that describes what they would like to achieve, as well as at least one measurable objective that they can use to measure accomplishment of that goal. The participant does not fill in the other sections. The evaluator then adds notes and action items in their section to reflect observations, any comments they have to share, errors or items that need to be followed up with. These notes are used in follow-up reports about immediate action items to address, or they can be used to reflect and acknowledge procedures that are already in place and working. Using a tool such as this for the exercise will assist with action items for follow-up, reminders, and can gauge the success of the exercise. Eric's going to run us through more of the worksheet.
Awesome. Thanks, Kim. So it is helpful for participants to have details provided or the ability to take notes to assist with engaging group discussion. Having details of the injects or messages in the order that they're presented can help to keep the exercise focused and on track. The first column can be used to list injects in the order that they will be given. The injects may be presented verbally or in other ways to stimulate TV or radio broadcast, email, or text message. You may want to create several injects to help meet all of the objectives of your exercise. The middle column is where you identify the objective you want to meet with each inject. The third column is optional and can be used by the evaluator to record time and details around the inject. So it's important to remember that a tabletop exercise is fluid and to allow for adaptability in response for the injects. The facilitator presents injects, which can then be discussed one at a time by the group. The facilitator should allow time for the group to discuss each problem thoroughly, balancing each member's time while keeping the exercise on schedule. As mentioned before, there are many different ways to introduce an inject. Being creative can keep the exercise engaging and exciting, as well as be more relatable to your organization. There is a lot of flexibility in how you can use injects, and there's no wrong or right way to use them. You could try different formats to learn your preference. And some considerations would be situation summaries and related discussion questions that could be given to participants to answer from their perspective of their specific role and then discussed with the group after, or the use of pre-scripted injects to the participants where each group discusses the inject and determines what additional information is needed or identifies what they would request in follow-up. And another consideration is to allow participants receiving injects to handle them individually, making a decision for their work area. And facilitators could combine these approaches, beginning the exercise with general problems directed to key participants, and then presenting injects one at a time to the other participants. So these are some tips for messaging and direction that can be communicated to participants in advance of moving into the scenario to establish expectations during the exercise. Some examples of reminders for participants are, this is a simulation exercise. Discussion will take place as a large group. Respond as you would in real life situation and allow others to do the same. Respect the perspectives of others and focus on solutions. As well as some reminders such as use paper for notes if it helps. There will be time limit set. There is no single solution. Dialogue is encouraged. Treat the scenario as if it were currently happening. Clarifying ground rules and providing these points can contribute to a productive exercise and establish clear expectations. I'll hand it back to Dana to begin the case scenario.
Thanks, Eric. So this is the portion of our session today where we have a simulated case scenario as an example that will be used to prepare to conduct a tabletop exercise in your facility. So the exercise or case scenario can be presented in many different ways, as Eric mentioned earlier. Ultimately, what you're trying to do is tell a story of a situation that can realistically happen, and your facility has to be prepared to work through the plans or the procedures that you have in place. So the scenario can be presented in a simple tool such as a PowerPoint or by the use of handouts or workbooks, but it depends on your preparation time. There are fun ways to present a story to your staff. We're going to show you an example of how to introduce a case scenario using a video format. But we want to just remind you, we're simply showing you how you could present a story or case scenario to your team. The intent of this presentation is to not actually work through this case scenario, but to talk about questions that each facility can discuss with their team. Each facility will have slightly different responses and different players. So some facilities might want to test different components of their response plan. So please keep that in mind as we begin watching a scenario unfold in a video format. Let's watch.
The IPAC Hub presents a case scenario. This is a simulated situation. Scenario background. In this community, there is a low level of COVID-19 community transmission. This region has greater than 90% of those 12 and older fully vaccinated. There are little to no cases of lab-confirmed influenza. Consider your home situation. How many units? How many residents? How many staff members? What is your home's vaccination rate for COVID-19 and for influenza? Let's discuss the potential scenario that is about to take place. It's Thursday afternoon at 3 p.m. There's a PSW that fails pre-shift screening and seeks testing. The report is a sore throat, slight chest and nasal congestion, fatigue, and general malaise. The PSW has been fully vaccinated against COVID-19 and has received an influenza vaccine. This staff member works on one floor of the home with only close contact with the residents of this floor. There are 40 residents on this floor. Lunch and some breaks are taken outside, but there is also a designated break space. Staff from other floors and departments can use these areas, like kitchen and environmental service staff. It's now Thursday evening at 6 p.m. A second PSW calls in sick for their shift. They have a low-grade fever and a cough. Their child, who attends daycare, has similar symptoms. The PSW's entire family is seeking testing. This PSW has been fully vaccinated against COVID-19, but has not yet received an influenza vaccine. Both PSWs work on the same floor of the home and only have close contact with residents of this floor. They take lunch breaks in a designated lunchroom on the floor with reminders of physical distancing in place. Last shift was the day before. What actions are needed immediately? What steps must be taken? Background information and details of an unfolding situation have been provided. Stay tuned, more information will follow.
So we hope you enjoyed that video format of a way to start showing a case scenario. And although a video presentation can be engaging, it isn't necessary. And you can use simple paper handouts or PowerPoint, and it can deliver the same message just as easily. So this slide here is showing you the introductory information that was presented in the video, but showing it to you in a PowerPoint format. It's important that you present the information clearly and concisely for understanding, and ensure the details that are specific for your facility are included to set the stage. The next two slides contain the additional introductory information for the scenario that were provided in the video. So this slide shows you the scene that is unfolding at 3 p.m. on the Thursday afternoon, and the slide notes the details that were all discussed in the video. The next slide talks about the rest of the introductory information to the scenario, which is into the evening of that first day. So it does take a couple of slides to show all of the information, and once all of the background and introductory information have been presented, it would be at this point where the facilitator engages the participants with some leading discussion questions. Let's review those on the next slide with Lana.
So it's important to remember, as we talked about earlier with the roles and the responsibilities, the facilitator's job is to introduce and present the scenario, which has just been done by Dana. And the facilitator then facilitates group problem solving by controlling the pace and the flow of the exercise moving forward. So here are some sample discussion questions that can be used to stimulate further discussion. So what are your immediate actions? What are some preemptive actions that can be taken while you await more information, like test results? And what are you considering planning for the following day? How easily are staff assignments and movements within the facility tracked, and who has access to these? And how accessible is staff and resident vaccination status? Again, who holds this information and who can obtain it? And remember when we talked about as a facilitator that you don't need to solve the problems or jump in with a solution, just continuing to acknowledge comments in a positive manner to facilitate participation through listening and supporting. As we move forward, discussion will be enhanced by using injects or updates following the first discussion questions. So once the first discussion questions have been answered and processes or plans for your first steps in this unfolding situation are established, then it would be time to enhance the discussion with an update or inject. So this can be presented with additional PowerPoint slides or with additional video. On the next slide is the case scenario update or inject in video format, and we'll continue to watch.
The IPAC Hub presents a case scenario. This is part 2 of a simulated situation. An update to the unfolding situation in a local home is provided. Update 1. It is Friday morning at 11:30 a.m. 6 residents on the PSW's floor and 4 on another floor are now symptomatic. A kitchen staff who is responsible for setting up the dining room before meals calls in sick and is seeking testing. All 10 symptomatic residents are swabbed for COVID-19 and the allowable amount for multiplex. 4 of the symptomatic residents have direct antigen tests done for influenza A, all of which come back negative. PSW number 1 informs the long-term care home of a positive result and is diagnosed with COVID-19. Mutation testing came back and the sample is indicative of the Delta variant. PSW number 2 informs the long-term care home of a negative COVID-19 result, as well as negative results from the rest of her family. More information will follow.
And moving on, the information is also presented in the PowerPoint format. So this PowerPoint slide continues to update and provide more information of the unfolding situation in the story. And the next day presents further issues and details that must be considered and acted on. And this is going to lead to further discussion points. So the next slide has some additional questions that Dana will review.
Okay, thanks, Lana. So with that update or inject that has just been presented, the facilitator, as Lana's mentioned, the facilitator must lead the group with more questions about follow-up actions at this point. So on this slide, here are some examples. Again, one of the first questions is usually, what's your immediate next action or your next step? What are the immediate priority actions after you're getting some positive results and information on results? What is your isolation plan? Testing of who is going to be tested, how is it going to be done, and what further tests should be sent. Thinking about what your communication strategy should be for those residents, to the rest of the home, to the families. Think about what is the threshold for declaring an outbreak? Would this be done preemptively? Will you wait for more results? What's the plan? What are your control measures that you're going to put in place? Thinking about education, we need to give some education. What education will you provide? So if a facilitator starts asking these questions and observes someone is struggling, they can try to help pull out an answer with other probing questions, and they can enhance the discussion. The facilitator can regroup by doing a quick roundtable with broader questions such as, okay, what is your biggest issue of concern or your biggest priority at this time within your role? This can help reset and regain some focus to promote a good, healthy discussion. So following addressing each of these discussion questions, that's when the case scenario can continue with another update or inject that will be provided. So let's watch the unfolding situation.
Update number 2, Saturday afternoon at 1:30 p.m. One of the residents who received a negative direct test receives a positive multiplex respiratory virus, PCR, for influenza A. 5 residents returned positive for COVID-19. There are now 20 symptomatic residents on the floor and 15 on the 2 other floors of the home combined. More information will follow.
So that was inject or update number 2 in the video format. And on the next slide, this shows it again in the PowerPoint format. So everything is listed here. So following this update or inject, the facilitator must lead more discussion questions. And Lana will review these on the next slide.
Although this seems like a lot of information to digest, a simulated scenario will unfold a lot faster in a tabletop exercise than it would in real life. So the facilitator just needs to be able to ensure that everyone understands this and is processing all of the details as you're moving through this more quickly. With this additional update information, here are some similar questions that lead to the next steps of your follow-up plans. So what are your immediate actions? This can include things like staffing restrictions, the considerations for handling symptomatic and asymptomatic residents, testing your residents, and any issues of concern with testing refusal from either the resident or perspectives of the family. With regard to the communication plan and strategy, considerations for communication for staff, residents, family, and potentially the media if there's media interest gained. And what will your control measures be that are put in place? And are the home's resources and planning sufficient to curb the outbreak at this point? So what other supports will be needed related to staffing, testing, physical resources? And once the facilitator has successfully addressed the answers, there's a third inject or a final update to assist with the wrap up of the scenario. So let's continue to watch and finish off the video.
Update number 3, 20 days later. In consultation with the Public Health Unit, the respiratory outbreak has been declared over. 12 cases of COVID-19 were confirmed among residents. No other staff were affected. 30 cases of suspected influenza occurred, with 1 resident still receiving acute care. This brings us to the end of the updates. And now, it is important to consider, what is the communication plan? What control measures might continue? All the updates are provided, and this is the end of the situational details. What will be done in follow-up?
So this quickly wraps up the scenario, but can lead to good discussion and follow-up questions. And we can look at the information presented on the next slide. Here's the final information to conclude this scenario. It provides an overview of the end of the situation, that in consultation with public health, the outbreak is declared over, and provides a summary of the numbers of confirmed and suspect cases. So the facilitator would then move into concluding discussion questions on the next slide. And at this point would begin to wrap up the discussion with the recovery plan questions. So some examples are, what is your communication plan? Again, staff, residents, family, maybe internal and external stakeholders. And what is the plan for operational recovery? What are the takeaways of the experience, or their future supports that should be considered for residents, staff, and family? Are there gaps to address, and what control measures will continue, or are there future considerations for IPAC measures? Once all of the concluding questions have been addressed, it's important to review how well the exercise worked for the participants, and I'll hand it over to Dana for this section to discuss the debrief component.
Thanks, Lena. So as Lena sort of pointed out, after a simulation exercise such as a tabletop, it is important to not only do your concluding questions, but also focus on a debrief and review the effectiveness of this type of exercise. So on this slide, it shows some sample questions that you can use in your debrief to establish how effective or what value this exercise was. Discuss any lessons learned, any comments about the exercise, any challenges or gaps, as well as unexpected issues that might have come up. You can use get feedback through post-survey questions to collect this information, but it's very important to record and follow up on any of the details that you extract from the debrief so that the follow-up action is taken to make sure that any identified gaps or issues are resolved so that you are prepared for a real life situation. The next slide talks about a quick summary of everything that we've learned today. We're coming near the end of the exercise or the education today. So in summary, it's really important to select an exercise that is going to be appropriate for the plan that you want to test. Make sure you plan ahead. These things do take time to prepare. Important to evaluate the exercise and your lessons learned. That's a key component in a tabletop exercise. You also want to write up an action plan to make sure that all the time you spend in performing the exercise is not wasted. So before we conclude, we want to give you what we promised in our objectives today. The Southeast IPAC Hub has prepared a reference document that contains additional case scenarios that were developed by others, but these are included in our references and they are adaptable and can be tailored to suit your facility. I'm going to turn it over to Sarah for more information on this.
Thanks, Dana. So like she said, we have two resources available actually. So the first one is a reference document. We note this as a build your own tabletop document, and it contains adapted case scenarios developed by others, but also with an added step of tailoring it for your own home and your own objectives. So I'm gonna just quickly bring it up to show everyone here. So think of it like a build your own Sunday bar. So it breaks it down step by step, and you can choose everything at each step. So in step one, you're going to select a community scenario. So this is where you're going to select community trends for COVID-19 and also influenza. Step two is also defining your home scenario. So this is where you're going to put your home's information. And in the context of a Sunday bar, step 1 and 2 is choosing whether or not you want a cone or a cup. So now we're going to go down to step 3, which is selecting a core scenario. So you're going to select one of these scenarios to go through with your team. So each core scenario has 4 chronological messages or injects that will lead the home into a confirmed COVID-19 outbreak. So this step is similar to choosing your ice cream flavors. So you can choose from your vanilla, your strawberry, or your chocolate. Unfortunately, you can't mix your ice cream flavors here because your messages will not flow too well. But as you can see in core scenario 1, you have message 1 along with some questions, brings you to message 2 along with some questions, all the way to message 4 with some questions. So next, you're going to add your mix-ins in step 4. So these are optional and additional situations that can be added to your case scenario as an extra layer for discussion. So each home can determine which additional messages they want to include in their exercises based on their own objectives and needs. So think of this as your toppings. So you can choose from your sprinkles, your chocolate chips, your whipped cream, and your gummies. They're all optional and you can choose what you want to put in. So along with these additional messages are extra questions to consider as well. And last but not least, you get to step 5, which is your recovery plan. So this is your cherry on top. So it brings you to the end of the outbreak and provides some additional discussion questions to consider. And now I'm going to hand it over to Caitlin to take us through this second resource as well.
Perfect. Thanks, Sarah. So for the second resource, we have a PowerPoint template, which will be available alongside the Build Your Own tabletop that is filled with the case scenario examples. So it is designed so you can pick what tabletop scenario you want and for you to be able to just plug it into the presentation template. It outlines a general presentation template that can be followed, as it also has sections for you to put in things like objectives and agenda. So the facility just has to fill in the unique particulars into each slide and they're ready to run their tabletop exercise. So now we'll go to the last Slido question. And so for the last Slido question, we will be asking, what will your next steps be to conduct this type of exercise? And we'll give everyone a few seconds to plug in their answers. Perfect. So it looks like we have some great next steps to start this type of exercise in the facility. And I will now turn it back to Lana.
Moving forward, if you have any questions or need support, please contact us by email. Also, feel free to visit our website for resources and education. As Dana mentioned at the beginning of the presentation, the session for today will be loaded on the website in the recorded format, as well as the education sessions that Caitlin mentioned earlier. We've outlined our resources on the next slide for references that help to develop today's education. And just to note that KFL&A Public Health previously did tabletop education with their long-term care homes. So that case scenario is included for your reference as well, incorporated into the additional case scenarios resource presented. There are larger exercise documents used as our resources that are also available and were included. And I'll turn it over to Dana for closing comments.
So thank you everyone for your participation in today's education. We hope that you have some good takeaways to use in your facilities. And as Lana mentioned, please reach out with any questions or assistance that might be required. Thanks so much, and we'll look forward to seeing you at our next education session. Bye for now.